Are you ready to be connected? You're listening to the Insured Connection podcast by Pica Group, a pro assurance company, where we provide expert advice for your practice when you need it most. We connect you with industry leaders to discuss timely topics so you can listen, learn, and get back to caring for your patients. Now, let's connect.
Well, hello, everyone. Thank you for joining us again on the Insured Connection. I'm your host, Dr. Adrianne Ross, and I am very excited, as always, to bring you some very interesting guests and just expose a little bit more behind the scenes as to within the field of podiatry and those that have been at work for us. And not just within podiatry, they've been at work in many different specialties, but specifically with respect to ours, I think it was very instructive to be able to hear from them. So please join me in welcoming Scott Maxwell and Terry Coleman. Well, hello, gentlemen. How are you doing this evening?
Terrific.
Great, Dr.
Adrian,
Ross.
hope you're doing well.
Thank you. Thank you. Well, Scott, I'll start with you. Tell us a little bit about the organization that you and Terry work for. What's the name and kind of how did it all get started?
Well, we work for a company that we founded called Government Solutions, LLC. And its intention is just that, to provide solutions to people who are dealing with, in our case, state government. We don't do very much federal affairs. It's generally state government. And basically, we come from a long background of having done this type of thing. And Terry Coleman was in the state legislature for 34 years and a former Speaker of the House and chairman of the Appropriations Committee for 12 years. So he has a lot of inside experience. Terry Matthews is a third partner, and he's been doing this along with me since 1997. So we've been doing it a long time, but we help clients deal with issues that come up in state government. And that includes state agency relationships, as well as what goes on in the state legislature, in the governor's office, and those types of things. And essentially, I think it's important for people in podiatry to recognize you don't want to leave a vacuum in a situation where this state government is making decisions about your profession. And you don't want somebody else speaking, well, let me tell you what podiatrists do, someone who doesn't know. You want the Podiatry Association to kind of represent all podiatrists, and that's who is our client in this case, is the Georgia Podiatric Medical Association. And so you want to be there to prevent someone else from filling a vacuum because you weren't there. And I won't ramble on too long, but that's essentially what we've been doing for a number of years, representing the association and looking out for their interests and trying to stay ahead of anything that might be against their best interest.
Yeah, so that's a great summary. I mean, you both are being quite modest, with everything that you've done. And just to give the audience a little bit more of an insight as to all the things that your organization does is you essentially are a voice for us, even sometimes when we're not a part of conversations, and because you have such great relationships, you're able to really advocate for us in more ways than one. So Terry, I just personal experience, I know that you all really helped us in Georgia, kind of clear the stakes with being able to get MD, DO, DPMs, being able to be in a multi-specialty type group. I mean, we actually passed that legislation, which is a big deal. So can you speak to a little bit of that as to, government solutions and being able to work with your relationships and helping us explain what podiatrists are and what we do.
Like what you're hearing? Go ahead and subscribe so you never miss an episode again. Now, let's continue to connect on today's topic.
I'm a fan, as you know, from day one. I was one of the ones. Scott and Terry and I had talked about it a lot. We were excited about the opportunity to represent podiatrists. So many people don't realize what the practice of podiatry is and what it means. With I like to throw out some facts. So many people don't not only know what podiatry is, they don't know how important it is to the whole body health. So we wind up in most cases making sure that people understand what podiatrists are, that their practices are more beneficial to the public sometimes when it's in a multi-specialty group, sometimes when they're in just private practice. But the key to our business and representing podiatry is, Scott, I would think, as much a defensive thing as it is a proactive uh, effort on behalf of podiatrists. Uh, many people don't realize that podiatrists have the same amount of, as far as training, that family medicine doctors, general internal medicine specialists, and others have, and that's 4 years of med school, 4 years of school before that, 4 years of podiatric med school, and then 3 years of a residency program. So we've opened some eyes by telling people a little bit or teaching them or educating them about podiatry. So anyway, it's been a fun situation for us, and it's also been informative for the members of the legislature, and even some of the regulatory people had not realized the background, the requirements to be a podiatrist, and the fact that what they do has so much to do with the whole body health.
Yeah, thank you for saying that.
Dr. Ross, do we have
Yeah.
time for me to tell a quick story to serve as an illustration?
Please do.
As Terry Coleman was speaking, it reminded me of a time I was sitting in a committee room, and it was a meeting between the House Appropriations Committee and the Senate Appropriations Committee, and the appropriations bill had made it through the House, had gone through the Senate, but had changes with it, and so they were meeting in a conference, what's called a conference committee, to sort out differences. And they got to this one subject matter, and I don't even remember what specialty it was, but they were kind of going back and forth over it, and somebody had to cut some money out to make the budgets in the House and the Senate meet. Something had to be cut here, and the other side had to cut something else. And
Sure.
they said, well, is anybody in the room that represents XYZ, whatever profession it was? The room was dead silent. That money got cut because there was nobody there to say, yes, we represent them, and here's why they need this money and stuff. Nobody was in the meeting, and they basically asked people in the audience who were mostly lobbyists like us, does anybody represent? And when nobody stood up, their money got cut. So that's another reason you need to have somebody looking out for your interests down at the state capitol.
That's a great story, because I know when you all helped us when we were speaking at an APMA event, where all the states were represented, I had several presidents and board members asking me from other states, well, how are you all getting things done? And, our response was, we've got great leadership. We have also got wonderful lobbyists, and it's definitely a luxury, but now it's the word has passed, so to speak, that if you have good representation, you've got a good team, so I love that idea of just having a really, really good team. So I do have a question though. So it's interesting to me. So for states that obviously don't have you all, where should they start? If they're looking for a good lobbyist team, and let's say their scope of practice is being threatened or anything to that effect, where should they even start?
Well, in some cases, we have mutual friends who are in the business. Scott's very modest. He and Terry Matthews were federal, worked with the federal Congress, U.S. Congress, Senator Sam Nunn's office for many years. So they have some connections. And what I always tell people is, hey, look, if we don't know anybody, we generally know somebody who does know somebody. So if we can help in any way, we certainly give it a try to help any of the states that don't have somebody as a spokesperson, that we'd be glad to try to help them find somebody.
And the other thing you can do in a state is you certainly have podiatrists have relations with other professions, and
Yes.
just say, do you have a lobbyist? Can your lobbyist recommend somebody could represent us if you think there might be a conflict for them? But you just ask around. Now, in Georgia, there's an association of professional lobbyists. I don't know if every state has that, because I was a founding board member of ours, so we haven't had it that many years. But a lot of states do have an association of lobbyists, and that's another place that they have a website that you could go to and get information.
That's helpful. Yeah, for our listeners, not all of our listeners are only podiatrists. I mean, we have chiro, we have dentistry, we have lawyer care. Pica really does kind of spread through, all the different disciplines, and it is really, really important for everyone to hear on the call, which is why I invited you to. That advocacy is just as important as the medicine or the care that we're giving to our patients or clients. So thank you for sharing that. And I do have another question though. With respect to podiatry, and I know in our field, I know we would have been at a loss if we didn't have you. So because of this, I think that a lot of younger practitioners that are coming in don't necessarily realize, kind of the importance of reinvesting into your profession. So when you're looking for physicians to come to Capitol Hill or to talk to, their representatives, what would be your word to them as to reinvesting into the profession that gave so much to them?
Well, Terry, I'll go real quick and let you chime in, but I guess the point I would want to make is you need to think about it in terms the way public health says we don't have a patient. The state of Georgia population is our patient. We want to improve the health of the entire state. You want to improve the practice of the entire profession, whether it's dentistry or podiatry or whatever it is. And the way you do that is by structuring rules and regulations and laws that are passed. And you can do so much more you might accomplish something at the state capitol that helps hundreds of patients instead of trying to do it one at a time. If it allows a podiatrist or any other profession to accomplish something on a regular, everyday basis, because we change the rules and regs a little bit along the way. So it's one way to think about it is how I can help so many more people by tweaking, and we're not saying huge change, but just tweaks in the bills, in the laws. Have a bill that changes just a little, and it can change the outcomes for patients in the hundreds and thousands. I'm sorry to go first, Terry. You could jump in there.
Well, let's think about too and I'm not sure I remember that since where were we going, Dr. Ross? Where would repeat your question one more time?
Yeah, the importance of young practitioners reinvesting into the profession and, lobbying or going up a
Right.
Capitol Hill. Why is that important from your perspective?
Want to receive a monthly newsletter with topics from the Insured Connection? Head over to picagroup.com/Insured Connection and join our email list to have it delivered right to your inbox.
So it's so important in every type association, whether whatever practitioner it might be, and especially in the healthcare field, to have people to recognize people who say volunteer, they ask the questions, they want to know what's going on. They're the kind of people that you and the association, and we help with groom them or kind of bring them along and use them for personal testimony, professional testimony to legislators, to answer questions. So it's very the way it's effective is you can't just say, let's call so and so. I think you need a group, you need people who have shown the interest, in your case, to you, by asking questions and saying, what can I do to help? It's very
Mhm.
important to have the, the initiative to want to help each profession.
Dr. Ross, another thing to think about is this way. Nobody's a better lobbyist than someone from back home in your district. And that's the way
Yes.
legislators look at it. So Terry Coleman and Terry Matthews and Scott Maxwell can go down to the Capitol and say, this is very important to podiatrists and so forth. But when you push it over, to get it over the hill, what you need is a podiatrist or a dentist or whoever from back home to call his legislator and say, this is important to me. Because the legislator knows, one, that he's a voter, but he's also an opinion leader back in his community if he's a physician of some kind. So I think it's very important to remember that you don't even have to go to the Capitol, although that's useful at times if it's a committee meeting or a special occasion or something. But talk to your legislator back in the district at his fundraiser or at some social event, or he's speaking at the Rotary Club. Go up and tell him who you are and that you have an interest and you'd like to stay in touch, give him your card, and that type of thing, and develop a relationship with your guy from back home. And if you get enough guys and gals from back home calling, that's when you get something done at the Capitol.
Very helpful. So there's not many people who can actually speak to, lobbying and also to what actually gets laws changed and legislation changed. So thank you so much for both of you being able to give us a little bit of the back end, because it changes our profession and also the perspectives on our profession as well. So thank you both for that.
You're welcome.
Well, everyone, again, join me in just thanking Scott Maxwell and Terry Coleman from Government Solutions and being able to show us kind of what happens, on the behind the scenes. And like they had mentioned, if you are in a state that you're not sure you have good representation, or if you even have an active lobbyist, please reach out to them and they can give you some pointers and some steps to go forward. For all the rest of you that are listening, please, tune back into the Insured Connection and stay tuned for some of our newer guests that are going to be coming on the show. So I appreciate it and have a wonderful evening.
And that's it for this week's episode. But let's continue connecting. If you're enjoying the Insured Connection, don't forget to leave a review on your streaming platform and subscribe now so you can connect with us each time we post a new episode. To stay connected with us throughout the week and to tell us topics we should discuss on future episodes, go to picagroup.com/Insured Connection.